Hello everyone, this is Sarah with Makin Wellness, and today I'm really excited to sit here and talk to you a little bit about how you can get your medical marijuana card in the state of Pennsylvania. So this is probably one of our number one most asked questions when we have people calling and people sending us messages. So the first step with getting your medical marijuana card in the state of Pennsylvania is you first and foremost have to have a qualifying condition. Right now, there are 23 qualifying conditions in the state of Pennsylvania, and the ones that qualify for mental health and addiction are currently PTSD or post-traumatic stress disorder, any type of anxiety disorder, opiate use disorder, and autism. So if you have one of those mental health conditions, you may be eligible. So in the state of Pennsylvania, you're really only supposed to be using medical cannabis in conjunction with another form of treatment, meaning that the medical cannabis is not allowed to be the primary form of treatment. You're really supposed to be in some form of counseling or some form of treatment for the mental health or the addiction condition as well. So if you have one of those conditions and if you're in counseling, you may be eligible. So what we do at Makin Wellness is that we have a assessment specifically to see if you fit criteria and you have that condition and if you may benefit from using medical cannabis. There are times where people think that they would benefit from using medical cannabis, but by the time they see the certifying doc, and sometimes the doctor finds out that they have some form of medication that will negatively interact with the condition, sometimes then they're not eligible to get it anymore, but that is quite rare. We don't see that happening very often. So basically, whenever you have the assessment, we ask you a plethora of a bunch of different types of questions. We make it as client-centered as possible, and we do our best to make you feel as comfortable as possible. So if we ask you a question about something and you don't feel comfortable, if you don't feel comfortable answering it, we can always ask you another question. So we make the process as client-focused as possible, and just like I mentioned, we do our best to help you feel supported and help you feel cared for. At the end of the assessment, then our clinician will go in and see if, based upon the results that you gave us, if you would be eligible. And then what they would do is they would fax them, if they'll tell you if you would be a good candidate for it. They'd also remind you how you're really supposed to be in counseling in conjunction with using the medical cannabis and get you scheduled in for counseling. And then they'll match you up with a certifying physician. So we work with certifying physicians and centers all across Pennsylvania. So before, we would really go out of our way to match you up with the closest and best rated medical marijuana doctor. But now, because everything's done virtually, we'll match you up with a doctor, or if you have a doctor that you really want to see, we'll match you up with them instead. So then we'll fax the medical record to them. And now you can actually meet with a certifying physician online, which we weren't able to do this before COVID-19. So this is one benefit to you, is that you don't have to leave your house for these certifications anymore. So you would then call the certifying physician, you make an appointment with them, and then you would go through a process, again, where you meet with a healthcare provider. They ask you a bunch of different questions and you answer them. They're not going to ask you very intensive mental health or addiction questions, since we already answered those questions for you on your behalf, and we sent that to them, so they have that information in front of them. So many times, it doesn't take a very long time to go through and meet with these doctors, and a lot of these doctors are really, really knowledgeable, and they really care about you getting the right education, you getting the right knowledge about medical cannabis. So at the end of the certification, they'll let you know if you'd be a good candidate and if you're approved to be part of the program. Most of the doctors that we refer to will certify for a year, which means that you have to see the doctor once a year to get recertified. However, there are some doctors that require you to come in more frequently. There's some that require you to come in every 3 months or 4 months, but we tend to just refer to the doctors that will certify for a longer period of time, because we do understand it can be difficult having to make, these very frequent and reoccurring appointments. So after that, you'd pay the state $50. I believe if you're a veteran, that it could potentially be waived or reduced. And then you would get your medical marijuana card mailed to you. After that, you would then look around and see what dispensary is closest to you and which one you seem to have a really great fit with. So there's a lot of dispensaries in Pennsylvania. Honestly, they're all extremely different. There's some that have a very strong emphasis on the medical side, and then there's others that, even though they are medical marijuana dispensaries, kind of have more of a casual vibe or more of a casual feel. We prefer our clients to go to dispensaries where we know the staff is really well trained and knows a lot about medical cannabis. So do your research and see, and ask around. A lot of really great resources that you can look into to learn about kind of like the dispensary ratings and everything. All the dispensaries are handling this COVID-19 situation differently, and a lot of them are doing curbside pickup, and I think there's some that are doing some online orders as well. So they're all different. Just look around and see which ones you want to try out, and ask around and see what your friends have been, benefiting from as well. So it's a very individualized experience. And the other thing to consider with medical cannabis, it's not a magic cure. It's not going to fix all your problems. It's something simply that you can use to help to cope, and it can be an additional tool in your toolbox. Every strain, people respond to every strain very differently, and it's great to build a relationship with a pharmacist at a medical marijuana dispensary, so they can kind of help you and help to guide you with which strains may be most helpful for you. And the other thing to consider too is the dosing, especially for clients with PTSD and anxiety, is extremely important. Microdosing appears to be quite helpful for clients that have a more actively triggered fight or flight response. And please also notice that it's especially important to talk to the pharmacist about what your symptoms are, so they can make better recommendations. And it's a very different experience compared to getting a traditional mental health psychiatric medication, because typically people are typically used to having the doctors tell them you're going to have 5 milligrams of Celexa twice daily. This is completely different. This is much more you driven and client focused. So that's the other difference too. They're not going to tell you, take this strain and this is the dosing you should do. And you guys really work together to see what is helpful and what is not. Another thing that we've noticed that appears to be quite helpful for a lot of our clients is using the strains with higher CBD amounts during the day, and to kind of help to level out, especially if you're noticing you're experiencing a lot of stress, and to continue to keep an open mind and continue to try different things, because with your mental health journey, there's always challenges and roadblocks in the way. Just like with this COVID situation, with all of us staying home and making a lot of big lifestyle changes and a lot of lifestyle adjustments, and that it's always important to stay on top of your mental health and to try different types of things to see what works and what doesn't. Like I mentioned, it's not a magic fix-all kind of thing. It can be really helpful for some people, and for some people it may not be so beneficial. We've noticed that people that appear to be treatment resistant, for people that haven't historically responded well to medications prior, it appears to be very beneficial for them. But of course, the only way for you to find out is for you to try it out to see. And we would love to help you out with that. So, if you are ready to have an assessment done, or if you're ready to work more on your anxiety or on your mental health, just give us a call and we are more than happy to help you out. Our phone number is 412-532-1249, and for ongoing treatment, we accept most major insurance companies, and right now most of them are waiving the copays, not all of them, but most of them are. So if you have any other questions, please feel free to DM us, and we are more than happy to answer. I hope you guys have a wonderful day, and we'll talk to you soon. Bye.